Okay, let's unpack this. If you, or maybe someone you care for, have been trying to sort through complex medical stuff, especially for conditions that really hit daily life hard, you're definitely not alone.
No, it can be overwhelming.
Absolutely. So today we're doing a deep dive into something called chronic mesenteric ischemia, or CMI. Our whole goal here is to clear things up, give you a solid understanding, so you feel more ready for those important talks with your doctors.
Right. And CMI, at its core, it's about your intestines not getting enough blood. Simple as that, almost.
Okay.
Think of the arteries in your belly like pipes bringing water to a garden. If those pipes get narrowed, often from hardening of the arteries, it's like a crimp in the hose,
Oh, well,
especially after you eat, because that's when your gut needs more blood flow to digest. That lack of flow,
yeah.
that's CMI.
Okay, that makes sense. And this is where it gets, well, really important for people actually going through it. What does CMI actually feel like
Yeah, the biggest clue usually is belly pain that kicks in after eating.
after meals specifically?
Typically, yes. And because eating brings on the pain, people often develop what we call a food fear. It's understandable. They might, maybe without even realizing it, start eating less, smaller portions.
Just to avoid the pain.
Exactly. And that leads pretty directly to weight loss, significant weight loss sometimes. The trouble is, these symptoms, they could sound like a lot of other gut problems, right?
Sure.
So diagnosis, it often gets delayed. That's why knowing these specific signs is so key.
So if this pattern sounds familiar, what should someone do? What's the next step?
Well, the term used is an extradiolated workup, which basically means doctors need to investigate quickly and thoroughly.
To rule other things out first.
Precisely. Things like other gastrointestinal issues. You might have tests like an endoscopy, maybe a colonoscopy. But often the best test for this is an abdominal CT scan,
Okay.
because that CT scan gives a really detailed picture, like a road map of the blood vessels in your abdomen. It shows where the blockages, those traffic jams might be.
And the diagnosis, it's not just the symptoms, is it? It needs that proof on the scan.
That's right. You need that combination. The classic symptoms, plus seeing significant blockages on the imaging. We're often talking over 70% narrowing.
70%? Wow.
In those key arteries, especially one called the superior mesenteric artery, the SMA. Think of that as the main superhighway feeding your intestines. Sometimes, even if it's just that one major vessel blocked, it can cause CMI if the body's natural detours aren't working well enough.
Right. The body tries to compensate, but sometimes it can't keep up.
Exactly. And that leads straight into why treating this is so important. The goals are pretty clear. Stop the pain, help you gain weight back, get your quality of life back.
And prevent worse problems down the road.
Absolutely. Prevent serious, irreversible damage to the bowel. And it's really critical to understand that just giving nutrition through an IV, for instance, that's not a fix.
It's a temporary patch.
It is. It doesn't solve the root problem, which is the blocked blood flow. That has to be addressed. I mean, without fixing the blood flow, some studies show a really stark picture, sadly, a 5-year mortality rate that can approach 100%.
Wow. That really underscores the urgency.
It does.
So, okay, understanding the treatment options becomes absolutely vital then. And the sources really highlight this idea of shared decision-making, right, between the patient and the medical team.
Yes, very much so.
Yeah.
For many people, the first recommendation is usually something called endovascular revascularization.
Okay, what does that involve?
Think of it as a less invasive plumbing job. We go inside the blood vessel, often through an artery in the groin or arm, thread tiny tools up to the blockage, use a small balloon to kind of push the blockage open, and then often place a stent. It's like a tiny mesh tube, sometimes covered, to prop the artery open and keep it open.
Okay. And the benefit there is less major surgery.
Right. Usually a shorter hospital stay, quicker recovery. The trade-off, though, is that sometimes it might need to be redone later on if new blockages form or the stent narrows.
So it might not be as permanent a fix sometimes?
Potentially, yes. Which leads to the alternative.
Which is?
Open surgical revascularization. This is more traditional surgery.
A bigger operation.
A bigger operation, yes. Usually reserved for situations where the blockages are very complex, maybe very long, or if that endovascular approach didn't work or isn't suitable for some reason.
So it's more involved, longer recovery.
Definitely. But the potential upside is that it often provides a more durable, longer-lasting solution to the blood flow problem. So typically you'd consider endovascular first, but open surgery is a really important option to have.
That makes sense. It's also important, I gather, to know that CMI can come back. Recurrence is possible.
It is, yes.
Yeah.
So patients really need to know what symptoms to watch for because new blockages can develop over time.
So stay vigilant.
Exactly. Regular follow-up is key. That means checkups with your doctor and often ultrasound scans to look at the blood flow. More frequent at first, then usually about once a year.
And if symptoms do come back or a scan shows a new problem?
Then the approach is pretty similar to the first time around. Often, you'd start again by considering the endovascular, less invasive option if possible. It's really about ongoing management to maintain that blood flow and quality of life.
Okay, so we've really unpacked a lot of crucial information here about CMI, hopefully moving it from something maybe overwhelming to something more understandable. Our aim always is just to help you have better, more informed conversations, ask the right questions for you, and feel a bit more in control of your health path.
Absolutely. And what's really, I think, quite powerful here is seeing how understanding even something complex like CMI can shift your perspective. It can move from being a source of anxiety to being, well, a tool for advocating for yourself.
That's a great way to put it.
So maybe for your next talk with your doctor, the question to think about is, based on everything we've discussed, what specific questions do you now have about which treatment path might be the very best fit for your unique body and your life?